were told to go back on the 29th of that very month of September. But it was unfortunate that on the 29th, I really felt so sick that I was actually put on oxygen, and the people who came to rescue me were those people from the UPDF who came with the army ambulance and took me to Entebbe, where I was attended to, and I was okay. So after that, Mommy was brought 3 days after to Entebbe. After that, we went to Mulago. From Mulago, I connected with some doctor whom we had studied with in Gulu, and actually directed us to some gyne oncologists. And there are only 2 specialists in Uganda, so it was actually a privilege to be connected to the only specialist because his colleague was not around. After meeting him, he told us that we can repeat another scan, of which we did from Chivuli Hospital, and also a CT scan from Chivuli Hospital and another from Kampala Imaging Center. From there, he told us that Mommy had uterine cancer, and the only thing was to remove the uterus in order to save her life and to prevent the cancer from spreading. Thereafter, we consented. We talked to Mommy, but she wasn't actually willing for the operation. We talked to her, and then after some time, she accepted. So when she accepted, we actually went to the doctor. That gyne oncologist who works in Mulago directed us to some private hospital, which is Ayu Medical Center, located in King Fahad Plaza, where the operation was held on the 5th of October 2020. After the operation, I was alone with Mommy. My sister would come and check on us, but I was the only one attending to her. So after that, she became better. On the 4th day, we were discharged and we went home. So we'd go back for review, and then the doctor was like, after the operation, he asked me that, how many are you in your family? I told him we are 9. Then he was like, I want to meet the 9 of you. I told him, no, it's impossible. At the moment, we are only 3 of us who are in Kampala, and you can still talk to us. He said it was okay. He told us that what he saw in Mommy after operation was not what the scan machines were saying. He said that the cancer had spread to the parts of the omentum, the small intestines, the large intestines, and he told us that he couldn't remove anything because if they could trigger, then the cancer would move very fast. So he just closed, and he was like, the uterus that the scan machines were saying was affected was very okay. It was only the ovaries where the cancer had started from. So thereafter, he was like, since Mommy is still weak, 1 month after, you should bring her back for chemotherapy. So we followed that. After 1 month, we took her back for chemotherapy, but she didn't respond to chemotherapy. She was just vomiting. She couldn't eat. She could eat 1 egg in a day plus half a cup of tea. But the whole night for the last 3 months, I used not to sleep because she would cry the whole day, the whole night. So thereafter, because they told us chemotherapy was to be given after every 3 weeks, so the doctor told me that you bring her back on the 1st of December for the second shot. So when it reached the 1st of December, Mommy declined. She was like, no, I was given chemotherapy and it didn't help me. You people, you rather look for me other options, but chemotherapy has not helped me. So we stayed with Mommy. We met some professor who also works in Makerere University, working in a joint herbal research clinic. Then he was like, the cancer is still in early stages, and there are people he has treated with the herbal medicine and he has worked. So we bought herbal medicine for Mommy worth 500,000. She took half a cup, then she was like, no, she vomited, she refused. We poured that medicine. Then another one gave us also from another herbal clinic still licensed in Kampala. Gave us also herbal medicine because Mommy was like, she doesn't now want hospital medicine, she wanted herbal. She took that very day. The following day, she refused. We also poured the medicine and we left it like that. So we told her, what should we now do for you? We told her the only option is to take you back to Mulago for chemotherapy. She was like, no. So when we talked to the doctor was like, no, it's better you bring her when the cancer cells have been suppressed, we shall repeat the operation to remove the tumors that had grown in her body extensively. But my friend, who is Dr. Taituk, had already told me that being a medic, I've just told you what my colleague has told me. Mommy's condition is worse, and if actually they were to remove anything, she would have died there and then. So they feared to remove anything. They just closed. So we took it like that, but I had hope that Mommy would be alive once again. So after that, we stayed. When she was to receive chemotherapy, the third shot, because she had missed the second shot, we talked with her and then she was like, she now accepted because she was hoping for anything. But talked to a friend of mine who told me that there are machines in the other side of Kenya, because these machines had showed that Mommy had cancer of the uterus, but when they opened, there was no cancer in the uterus. Told me that if you can connect and bring Mommy to Kenya, but there are expensive hospitals there. If you have like 15 million and above, it is okay. I talked with my sister, we organized the money. I went alone. No, I first went with Mommy. Actually, it was actually illegal crossing even of the border. I maneuvered my ways. I crossed with Mommy with a motorcycle in her condition, and she got treatment from some Indian who repeated their test, and he was like, your Mommy doesn't have cancer, that is the kidneys and the liver that are affected. So now we became confused, basing on, and before that in Mulago they had removed the samples for biopsy, but the biopsy revealed that the cancer was in early stages. But what the doctors had seen, and they had taken a video of that and showed me the video, told me that is not rhyming with what the blood samples and the biopsy samples are saying. So now they also became confused. Then they were like, let's give ourselves time. So it took the doctors 1 month for them to decide that Mommy should be given chemotherapy, as they were still repeating investigations. And they sent us to different hospitals apart from Mulago to do the tests and imagings to compare and contrast and see what they can base on. So when we reached Kenya, the medicine she was given, I was first asked to give 10 million. I actually had 7 million with me. I called my sister, she added 3, and she got the medicine. When she got the medicine, she actually was okay for 3 weeks. She even ate. She was even washing her clothes. Then she was like, this medicine has worked for me. So after that, because the total cost, the Indian told me that he wanted around 25 million for the whole treatment. And since I had given 10 million, I now came back home with my sisters and we started looking for money. So because the dose he had given was little, I would now go after every 1 week. If I get like 3 million, I just cross the border. I rush. If I go early in the morning, by 11 I'm in Kenya, I'm coming back. I reach Kapchoro at around 10, 11, and by midnight I'm already traveling to Kampala. By 8 I'm in Entebbe to give the medicine to Mommy. So the second time I took the medicine, she actually responded like for 3 days. Then after that, the medicine didn't work. Then I told her, now what should we do? We stayed for 2 weeks. We looked for, I called back the Indian. He was like, you look for the balance, you bring, and then I give what? Another dose of the medicine to her. So when her condition was not really okay, I thought it was really wise for me to go back with her and they recheck her. So what I did, I organized for meals. I went back with her on the 25th of December. When we reached there, the Indian said that you give the balance. We gave the balance, he gave the medicine. Then we came back home, but the medicine didn't work because I had now gone with a balance of 15 million. So the medicine didn't work for her. She took like for 2-3 days, she was like, it's like this medicine is no longer working. She was like, you people look for me other options. Then I contacted other friends, also the other side of Kenya, who told me that, yeah, that Indian used to treat people, but I don't know if it doesn't bring the medicine that works nowadays. Then that one connected me to another gynecologist who is called Dr. Ningori David. He's a consultant working in Kitale District Hospital. When I met him, he actually connected me to a gynecologist also in Eldoret, because he told me in Kenya there are only 4 gynecologist who have specialized in the reproductive system and cancer. And he told me 3 are in Eldoret and 1 is in Moi Teaching and Referral Hospital. So he asked me an option, that would you like me to connect you to Moi or Eldoret? I told him that it's better you connect me to Eldoret. Then he was like, it's okay. In Moi, people who have cancer like this, they use them as teaching and learning aids. So I wouldn't really advise you to take her to a teaching and learning hospital like Moi. So the doctor connected me to some gynecologist called Dr. Benjamin in Eldoret. So when he talked with him, he asked me that, whom have you come with? I told him I only came alone with my auntie and the patient. So the gynecologist said that it would really be fair if this other gynecologist who works in Kitale looks for a nearby hospital, and he travels from Eldoret to come and operate mommy. After doing the scan and removing the blood samples to check if the kidneys and the liver were still functioning well. Then he sent the other gynecologist the results on WhatsApp. Then he was like, yeah, if mom is still moving a little bit, that one we can. The only option is the cancer cells had overgrown and there was a big tumor pressing on the guts, so that whenever she would eat, she would just vomit. And he told me that he had already reached stage 4, where the cancer cells had really spread and there was a tumor in the liver, then another tumor, there was a big tumor that was pressing on the intestines, and most of the intestines had already been eaten up by the cancer cells. So being a medic, I really understood that it was the end of, my mom was coming to the end of life. So after that, the gynecologist told this other gynecologist in Kitale that he was busy in Eldoret and he would come to Kitale on Wednesday and do the operation on Thursday. And we had gone there on Sunday. But mommy was really in a terrible condition that she had not been eating for a week plus. Not even water. If she would take, she would just vomit. She couldn't even sit down. And we would stay awake the whole night while she's just crying. So when the gynecologist came, he was like, the only thing is the cancer cells had overgrown. Even the chemotherapy could not help, but the only thing is to remove the tumors. Then after removing the tumors, they give chemotherapy so that she can still live for some small time, maybe 5 to 6 years. He told me it wouldn't be long if she was to come out of the surgery. But he told me that all the people whom they do surgery, 80% of them die within a period of 2 to 3 weeks. We even called mom and explained. She was like, she has suffered enough. Let them just operate her. Whatever happens, let it happen. So actually, the person who hosted us in his home is a friend called Caleb. I think he can first stand up for recognition. Cheer up, Caleb. Caleb and his wife really helped us because we are strangers in Kenya. We didn't know anyone. They hosted us in their home. They would cook for us, bring food to the hospital. do anything that we really needed. But they even didn't ask us for anything in return. So all the things were, when we went and stayed in his home for those 3 days from Sunday to Wednesday. But on Tuesday, Mommy was like, I'm really in terrible pain. She asked me that, did you bring me to your friend's place or to take me to the hospital? I told her I was taking you to Eldoret, but they have helped us. It's of privilege that the doctor is coming from Eldoret to do the operation from this way, because the hospital where we are going in, they told us was really expensive, that it would even require 5 million per day. So when this gynecologist told me, he was like, can you afford the 150,000 Kenyan money? I told him that, yeah, I can give the little, and then we solicit for the others, of which when you exchange is around 5.1 million Ugandan money. So when he asked me for that money, I was like, this is little money. We have spent more than 30 million on Mommy, and if this can help, this is really little money. So after that, on Tuesday, Mommy really cried and asked me that, did you bring me to your friend's place or to the hospital? I went back to the doctor in the hospital, and then he was like, we are on process. You can remove her blood. We can do grouping and cross-match. I can start for people to donate the blood because she really needed fresh blood. So I actually went and explained to Mommy, but she was not understanding. She told me that, my daughter, if a knife was near here, I would just get it and then I operate myself. I remove this tumor because you don't know the pain that I'm feeling. So I really felt bad. Then I kept pressurizing the doctor, and then the doctor was like, it's fine, you come. He went and prescribed for me some medication for pain, and I went to the district hospital. When I gave her, the medicine helped her, and the following day we went to the hospital at around 3 p.m. So when we went to the hospital, they booked her for surgery, and that was on Thursday. But the surgeon came late from Eldoret. He reached at around 3. Then at 4, he took Mommy to theater and they operated her. But the operation took long. It was from 4 up to 8 p.m. when she was brought back, but she was brought back alive and she was talking. But in theater, I think they only had maybe 2 units of blood. They kept running up and down looking for blood until they added her 3 units of blood while they were operating. I even thought she couldn't make it because the surgery was extensive. The cancer cells had eaten up the intestines, the omentum, and there were tumors in the liver. Then the surgeon told me that also during the process of removing those tumors, he injured the rectum, of which they had repaired. So he told me he cut out both the large and the small intestines. It was really a big part. Then he told me that, as I told you, if Mommy makes it after 1 week, then we are good to go. After that, she can start chemotherapy. Then I asked him about depositing the hospital bills. He was like, no, don't first pay any money in the hospital until we see how she progresses. So I stayed. I didn't pay any money. We are getting all the treatment, all the attention. He called after the surgery on Thursday. Then on Friday evening, Mommy was injected with a strong painkiller that was given directly into the vein. That is Bethidine. And Mommy actually collapsed, and she actually collapsed for something like 2 hours when they even told us that she's dead. So after them telling us that she's dead, I actually came and called my friends and told them that Mom is dead. So after that, when the doctor came, the doctor was like, it was the side effect of the strong painkiller that was given. He rushed with his vehicle to the hospital pharmacy and he picked another drug called naloxone, which they came and injected. And after 1 hour, after being put on oxygen and that, she came back to life and she started talking. That was on Friday evening. Then now on Saturday, she was very okay. She was talking with us. It was actually unfortunate that From that time when they operated her on Thursday to Saturday, the urine bag had no urine. It was only 150 mils, and they had given her over 3 liters of fluid. Over 3 liters of fluid. So when I saw the urine output, being a medic, I was like, this is already a bad sign. She can't make it, because she was already puffy, and what was being given to her was not coming out. I told the doctor, it's like the kidneys are not functioning. He was like, yeah, but let's monitor her blood pressure. So the following day when they took the blood pressure, it was not recordable. Mommy started becoming aggressive, and she now started losing her senses, but she had some sense, some small sense. Then she asked me, that has your dad called you? I told her no. She was like, it's fine. If he has not called, if I die, let him not come for my burial and take me to our home. So it is me actually who has made Mommy to be buried here, because I was alone with her, and actually I wanted her wish to be fulfilled. So after that, she again asked me that, has your elder sister come? I told her no. She's actually coming, don't worry. So she kept asking that, you give me water, but I didn't give her water. So after that, she went into a coma on Sunday. It was on Monday. It was on Monday when she went into a coma, because on Sunday we are talking, she was actually laughing with us. Then she told me that, the route that you brought me, I don't want that route again. Maybe you will look for another route as we are going back. I told her it's fine. So actually on Monday, the blood pressure was not recordable again. I called the doctor because he had given me his number. It was like, this is already a bad sign, but she will be okay. When they gave her normal saline, the blood pressure came back to normal, and she was better. That I really had hope that she had come back to life. I didn't know that she was just telling me the last words. So when the doctor came, the doctor asked, who is this? Mommy couldn't say. But he had already told me her last words, that if I die, take me to our home and let your dad not die, since he has never called, and for the last 3 months we are in Mulago, he didn't come. So I actually respected her will, and I told her, no, Mommy, don't think about death now, you will be okay. So after that, when she went on Sunday, when my uncle came, Uncle Stanley came with the Uncle Fadul, I asked Mommy that on Monday, do you know these people? She was like, I don't know them. I was the last person she talked to, and she kept quiet like that. She never talked to us again. So she went into a coma from Monday, and now on Tuesday, she was put on oxygen from Tuesday. Then on Wednesday, my sister and my brother came. When they asked me that, how is Mommy, I did tell her that she was actually in a coma and there was no hope for life, and doctor told me that you are a medic, just be strong. I had already told you, let's just pray to God, but it is beyond us now where she is in. So I started crying that very Tuesday, and by the time she died, even my tears had already reduced. I really had little to cry. So when my sister came on Wednesday, she actually cried until she collapsed. Then she was like, so you mean Mommy was in a terrible condition like this on oxygen? She's in a coma and you didn't tell me? I told her, even if I was to tell you, there is nothing. Even the doctors have said it is only God, it is beyond them. So I asked the doctor what could have really caused her. Doctor was like, because the kidneys were not functioning and the liver was not also functioning, what's happened is the uric acid went into the bloodstream and she developed uremia, which went into the bloodstream and it went actually to the brain. Coupled with the low immunity, the infection from the operation site started forming pus, and the antibiotics they were giving her didn't respond and it went to the brain. So on Thursday at 2, Mommy braced her last. That was yesterday, and we now paid the hospital bills. I told Dr. Ikem, he was like, no, don't give me for the other surgeons. I will see how to compensate them. Just give me the little you have, and you keep going. So that's how Mommy left us, and I really thank God that she left us when we were big, and there's only our last born who is in senior 5, and actually she struggled to educate us and make us whom we are. At least almost all of us have jobs, and I think I'm even the least paid among the people who are earning. But I thank God that she left a legacy behind. And Mommy entrusted me with everything. Even my sisters don't know her account, her ATM. No one knows. I'm the only one who knows everything, her PIN numbers, everything I know. So that is what's happened, and that was my mom. She has died a hero. But for our dad, we also love him too, since he educated us also, and he was there for us as a dad. Though not to that extent, because he had another wife that he brought in some segregation, but all in all, I still love him because he's my dad.
Thank you very much. Kate Romani for the report.